When taking care of a family member, it's very easy to lose sight of taking care of yourself. I'm Dr. Freda Lewis-Hall, Chief Medical Officer of Pfizer, and I'm here today with award-winning actors Jill Eikenberry and Michael Tucker to talk about the importance of caregiving to the caregiver. So thank you so much for coming.
Oh,
Welcome
I'm delighted to be here.
both of you.
Very nice to be here.
So, Jill, you've spent some years, both of you and your family, taking care of your mother. And during that time, you had some experiences where you yourself needed some care. Can you talk to us a little bit about that?
Yeah, my mom came to live with us, or across the hall from us in our apartment building in New York in 2007, having lost her husband and having fallen into a pretty advanced dementia. So we had full-time care for her at the apartment. And in 2009, I was diagnosed with a recurrence of my breast cancer, which I'd had in 1986. But you know, you can't help wondering if the stress that I went through wasn't part of the equation. And it was hard to hear that word recurrence. It was really hard for Mike.
Yeah, I think recurrence is terrifying. And I ended up writing a book about it, a book of fiction about a man who loses his wife, because that's all I could think about. You know, our whole thing, who I am, is at least half here. You know, if she weren't here, I don't know who I would be. So it was a scary time.
If you think about the years 2007 to 2009, and you kind of quietly thought about, was I taking care of myself in that time? What would the answer to that question be?
I was sure trying to take care of myself. I was, I'm good at exercise and eating well and that sort of thing. But I think my stress level was just unbelievable because as I said, I had done a lot of caretaking of my mother for a long time. And my first cancer, I know you can't draw lines to things, but my first cancer came a couple of years after my mother was diagnosed with colon cancer. And I don't think it's an accident that my first cancer occurred then and my second cancer occurred when I couldn't save her from the fall into dementia.
You know, it's interesting that you would make that connection. What we know now about caregivers is that they often neglect their health and their self-care, and as a result of that, find themselves at higher risk for cardiovascular disease, for developing diabetes, for some cancers. Mm-hmm. To take care of yourself as caregivers is really critical, making sure that you keep your appointments, that you're vaccinated, that you're kind of up to date on your own health plan, and that you really pay attention and implement it with good diet and exercise. You've engaged with other people, developed a network to talk to people about what's going on with you, but to also ask very specifically for help when you need it. And I think that's very, very good for caregivers to learn to do.
I just have evolved to know that I pretty much think that the more transparent you are, the better. That if you can really open up and talk about how you're feeling, that you'll have a much better time of it in general, and especially in a situation like this. So I think the fact that experience ended up being much more positive is a funny word, but positive than the first time, and that I, really didn't feel victimized in the way that I had before. I felt empowered. I felt like I could be proactive about my disease, could choose my physician, decide about my treatment in a very clear, present way, helped me then to talk about my mother's situation, what she needed, how to talk to doctors, how to talk to the medical establishment, how to ask the questions became, a bit clearer for me. So I think it was actually a help.